Hi, my name is Serena, and today we will be talking about under-identification of mental health issues in older adults. Addressing mental health in older adults is paramount for various reasons. Quality of life. Improved mental health enhances older adults' overall well-being, fostering a sense of fulfillment and satisfaction in their daily lives. Mental health issues can also exacerbate physical ailments, so addressing them can positively impact physical health outcomes and reduce the risk of chronic conditions. Strong social connections are vital for mental health, especially in older adults who may face loneliness and isolation. Addressing this can help maintain meaningful relationships and community engagements. Mental health conditions can impair cognitive function, but early intervention can potentially slow cognitive decline and improve overall cognitive function in older adults. They also have a higher risk of suicide, making it crucial to address mental health issues to prevent tragic outcomes and provide necessary support. Necessary support could include caregiver support, which involves caring for their caregivers who may experience stress and burnout. Addressing mental health concerns in older adults can indirectly support their caregivers' well-being as well. Untreated mental health issues in older adults can lead to increased healthcare costs, decreased productivity, and higher rates of disability. By addressing mental health, we can also mitigate economic burdens. Some common mental health issues are depression, anxiety disorders, dementia, substance abuse, bipolar disorder, schizophrenia, sleep disorders, and adjustment disorders. There are a number of barriers when we try to identify mental health issues in older adults. Cultural stigma surrounding mental health may prevent older adults from seeking help or disclosing their struggles due to fear or judgment. Lack of awareness. Older adults and their caregivers may lack awareness of mental health symptoms or make mistake for normal signs of aging, delaying recognition and treatment. Older adults may also hold belief or attitudes that mental health issues are a personal weakness or should be handled privately, hindering open discussions and help-seeking behaviors. Healthcare professionals and older adults may prioritize physical health concerns over mental health, leading to mental health issues being overlooked or dismissed during medical assessments. Older adults may also have difficulty expressing their mental health concerns due to cognitive decline, language barriers, or communication disorder, making it challenging for caregivers and healthcare professionals to identify issues. Older adults may face barriers accessing mental health services, including financial constraint, transportation challenges, or limited availability of geriatric mental health specialists. Mental health issues often coexist with physical health conditions in older adults, making it challenging to distinguish symptoms and prioritize treatment appropriately. Age stereotypes and biases may lead healthcare professionals to attribute mental health symptoms to normal aging, overlooking the need for further evaluation and treatment. Addressing these barriers requires a multifaceted approach, including increased awareness, reducing stigma, enhancing access to mental health services, and integrating mental health screening into routine health care for older adults. There are a number of impacts of under-identification of mental health issues in older adults. Some of them are decreased quality of life, physical health complications, increased healthcare utilization and costs, risk of suicide, decline in cognitive function, impact on caregivers and families, social isolation and loneliness, and reduced resilience and coping skills. Some evidence-based strategies to help identify mental health issues are routine screening. Implement routine screening protocols for mental health issues during primary care visits, especially for older adults. Screening tools such as Geriatric Depression Scale and the Patient Health Questionnaire can help identify symptoms of depression and other mental health disorders. Education and training. Provide education and training for healthcare providers, caregivers, and older adults themselves to increase awareness and recognition of mental health issues in later life. Training should include information on risk factors, signs and symptoms, and appropriate interventions. Integrated care models. Implement integrated care models that integrate mental health services into primary care setting. Collaborative care models, where primary care providers work closely with mental health specialists, have been shown to improve detection and management of mental health issues in older adults. We need to use telehealth and telepsychiatry services to improve access to mental health care for older adults, especially those in rural or underserved areas. Virtual consultations and therapy sessions can overcome barriers such as transportation difficulties and mobility limitations. We also need to implement multi-component interventions that address both mental and physical health needs of older adults. These interventions may include elements such as medication management, psychotherapy, physical activity, social engagement, and nutrition counseling. We can also develop and support community-based programs and support groups aimed at promoting social connectedness and providing peer support for older adults experiencing mental health issues. These programs can help reduce social isolation and improve overall well-being. We can also offer support programs for families and caregivers of older adults with mental health issues. Caregiver support groups, respite care services, and education programs can help caregivers cope with the challenges of caring for a loved one with mental health needs. We also can develop culturally tailored interventions that take into account the unique needs and preferences of older adults from diverse cultural backgrounds. Culturally sensitive approaches can help to reduce stigma and improve engagement with medical health services. These are the references used in the presentation.